Good afternoon, everyone. Thank you for joining us for our bi-weekly COVID media briefing. We're pleased to provide an update for you today and have lots of information to share. Today we're very pleased to have with us several of our elected officials. And so to get us underway, let's start with a land acknowledgement. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so let's start us off with some opening remarks from our Board of Health Chair, Mayor Andy Mitchell. Please go ahead, Mayor Mitchell.
Thank you, Brittany. This week, Ontario announced a further easing of restrictions as hospitalizations and ICU admissions decline. This is welcome news, both by businesses and individuals. However, it is important that each of us continue to make decisions about our actions based on our individual risks. If you are immune compromised, elderly, unvaccinated, or work or live in a high-risk setting, you should make decisions about what and how you do things based on what best protects you and those around you. Getting vaccinated with 3 doses, masking indoors, avoiding crowded venues, and staying home when you are feeling ill remain the best ways to mitigate your risk of contracting COVID. It is important to remember that as we are able to begin a return to normalcy, that we are doing so not in spite of public health measures, but because of them. The paradox of public health is that you are never able to prove what your actions avoid it from happening. However, Canada's results, vis-a-vis many other jurisdictions, speak to our success. Our collective sacrifice has meant that lives have been saved, illnesses prevented, and our health system maintained. As we watch events unfold in Ottawa and elsewhere, it is important to remember that the heroes in the story of COVID are the ordinary Canadians who each and every day did what was required, not because it was easy, but because it was necessary to protect themselves, their families, and their communities. They got vaccinated. They wore a mask. They limited their social interactions. They worked or learned from home, and they suffered emotional and economic hardship. Their dedication to the well-being of their community, along with the commitment of healthcare workers, first responders, and others, is what I believe defines the Canadian response to COVID. To all the exhausted men and women who have given so much for so long to so many, I say thank you. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, we're actually going to change things up a little bit this time, and we'll begin with some comments from our elected officials. And we understand that MP Michelle Ferrari is going to be joining us today. I just need to resend her the link, which I'll do in just a moment. So perhaps we can start with our MPP, Dave Smith. If you've got some comments for us today, please go ahead, MPP Smith.
Thanks, Brittany. I greatly appreciate that. I was planning on talking about rapid testing first, but as Mayor Mitchell was talking, I thought I want to expand a little bit on what he said. At the very beginning, he said that it's very difficult to demonstrate what the public health measures have done to prevent deaths and infections. And he's right. When you do those things, it's hard to look at it from your own jurisdiction. But what I'm going to say on it is that if we take a look at the very first wave that we had, and we compare ourselves to New York State. New York State is about 20% larger population-wise than Ontario is. They did not implement any of those public health measures until they were well into that first wave. In Ontario, as part of the first wave, we had about 1,800 individuals who died of COVID-19. In New York State, where they are roughly 20 to 25% larger than we are, they had 35,000 individuals who died as a result of COVID-19. So I think if we take those two jurisdictions, and we have had very similar paths ever since, we look at what New York did not do, and we look at what Ontario did do, and we had 33, almost 34,000 less deaths than they did in New York State. So I think, although I agree with Mayor Mitchell that you can't look in your own jurisdiction and say, we saved this many people, I do think we can take that comparison with jurisdictions that are right next to us and see what they did not do and what their results were as a result of it. What I do want to talk about for most of my comments, though, are rapid tests. And the fact that our rapid test program in Ontario has rolled back out again and is doing very, very well with it. We have a very solid supply of rapid tests coming in, both the BTNX tests and the PanBio tests from Abbott. They're being deployed to schools. We have been able to maintain our supply at the long-term care, congregate care, and healthcare settings all throughout this. And we have restarted our business program so that those large employers are getting rapid tests to test their employees prior to the start of a shift. And the Chamber of Commerce program has been restarted. All of the back orders that we had for rapid tests for those small businesses, we have been able to fulfill. And the Chamber website, peterboroughchamber.ca, will go live again today. So any small business that is looking for more rapid tests, later on today will be able to go onto the website, use the calculator to figure out how many they need to keep their employees safe, and restart the program again. They also are available for the general public. We started that last week with a rollout to 20 different locations in this riding. If we look at all of Peterborough County, it's almost 30 locations in total when we take into account Cavan Monaghan, Asphodel Norwood, and Autonomy South Monaghan, which are not part of my riding. But we have a significant number of locations where it's possible for someone to go and get the rapid tests. Each of those businesses will be restocked on a weekly basis. So if they're not available at your favorite location today, they will be again in a very short period of time. We expected that the first week or two, there'll be a lot of people looking for them. Then it will settle down again and it'll become a more regular routine. And our expectation is that by this time next week, they'll be readily available for everyone on every single day. My suggestion to you, though, before going to one of those stores, give them a phone call and make sure that they do have them in stock. And if they don't, find out when their shipment is coming in. Every store is going to be restocked on a weekly basis based on how many they gave out the week before. I also want to say thanks to Dr. Piggott. Dr. Piggott has done a fantastic job, in my opinion, keeping our community safe. I know it has been a difficult challenge, and I know I have said it in the past. I take my hat off to any individual who travels halfway across the country to come to our community to help. So once again, Dr. Piggott, thank you for all that you're doing. Thank you for looking after the best interests of the people in our community. And I look forward to answering any questions if anyone has any for me at some point later on today. Thank you.
Wonderful. Thank you so much, MPP Smith, and really appreciate you joining us today. So now I'd like to invite our MP, Michelle Ferrari, to join us. Thank you so much for logging on, and I'm going to spotlight you in just a moment. So please go ahead with any remarks that you may have, MP Ferrari.
Thank you so much. Can everyone hear okay?
Yeah, we can hear
All
you
good.
just
Thank you
fine.
so much. Really appreciate being here today. As you know, things in Ottawa are pretty intense and historical today. So happy to be able to join you from my Ottawa office. I'm gonna read a statement that I've prepared for everybody. As a member of Parliament for Peterborough Kawartha, my office has received thousands and thousands of phone calls and emails from constituents sharing a wide range of opinions, perspectives, and heartbreaking experiences throughout this pandemic. My job is to represent and to serve all constituents and to look at all factors that impact our community. Peterborough Kawartha has an extraordinarily high demographic of seniors, and we must be diligent in protecting ourselves, protecting others, and being smart about our decisions. Having access to tools such as tests, vaccinations, boosters, and masks are important. On Monday evening, I presented a speech in the House of Commons where I acknowledged the pressures that have been placed on our already overburdened healthcare system. This debate was to ask to have more experts speak in front of our health committee, bring in more doctors. It was asking for an amendment to discuss further. The recent proposal for 2.5 billion to be spent across to rapid tests for Canadians would be better allocated if directly transferred to the provinces to provide the support that is so desperately needed and requested by premiers across Canada. We need to help our healthcare workers and our healthcare system. Furthermore, the need for access to rapid tests should have been addressed long before now, and I appreciate all the work that's being done by our MPP and businesses to offer access for people to have them. I've had many great conversations with Dr. Piggott since he joined us. I deeply respect his open communication and communicating with the public. We all need to continue to work together and to support the tireless efforts of Peterborough Public Health and our healthcare community. Thank you.
Thank you so much, MP Ferrari. So pleased to have you with us today. And hopefully you can stay on the line in case there are questions at the end when we get to that part of things. I'm now going to invite our County Warden Jones to share any remarks. If you've got some comments for us today, Warden Jones, go right ahead.
Well, thank you very much for including the county again. I'm certainly not going to be as deep as other comments. I think everyone has said it all. I guess what I'm going to zero in on are a few words that Andy said at the beginning, as he says with all his little talks at the end. Let's be kind. I just had enough, and I think everyone has, of this negative, mean-spirited chit-chat between people on either side of the coin. It's fine to have an opinion, but my goodness, some of the tones that I've heard from people are totally unacceptable. We're one big family here in the Peterborough region. My goodness, if we can't get along, agree to disagree, and have some respect for each other, then something's really, really wrong. Let's everybody look in the mirror and maybe tap ourselves on the side of the head and remember what we're all doing here. Dr. Piggott, I sure appreciate the work you're doing. I just want you to know that. Peterborough County are behind you every step of the way. So, as Andy Mitchell loves to say, let's be kind. Let's say that 10 times in a row. Maybe we can get somewhere. So please stay safe, everybody. Peterborough County and City and Curve Lake and Hiawatha, we're all in this together. Thanks.
Thank you so much, Warden Jones. Okay, I'm going to now turn it over to our Medical Officer of Health, Dr. Piggott, to help us understand these next few slides that depict the local COVID situation. Please go ahead, Dr. Piggott.
Thanks so much, Brittany, and good afternoon, everyone. I hope that you're doing well on this rainy, wintry day. We're going to go through our vaccination dashboard first. And what we're seeing here is that rates continue to increase slowly. But since about 2 weeks ago, we have an additional 4,000 doses given, which is good. I'm particularly interested in the coverage that we're seeing for the 5 years and older, which is standing at just over 53% for boosters, the booster coverage there. So again, anyone as of tomorrow, 12 years and older, is eligible for a booster if they haven't already had one. And we know that that is really very important protection against this continued pandemic. On to our next slide, you can see in relation to other health units in the province, we're actually in 4th place, which I think is good. In the Olympic spirit, just missing the podium. I think we can always do better, but I think it is showing that we've had overwhelmingly positive appreciation and uptake for the vaccine in our community, and we need to continue to support this. And we'll be, continuing to offer significant access, including walk-in clinic access, many different times of the day, so that we can make the vaccine as accessible as possible to everyone. On to our next slide there, Brittany. Here you can see the continued protection that the vaccine is giving. And the drop off we can see was attributed to when Omicron came, we realized that 2 doses was not enough, that 3rd dose is really critical for protection, especially against infection, but also against ICU and hospitalization. And what we can see now that people are starting to get that 3rd dose is that overall number is increasing and is now above 60%, which is really encouraging and helpful information to know that it's not perfect and it's not quite as good as it was before Omicron came along, but the vaccine's still protecting us and helping us to protect others who are more vulnerable around us by stopping infection. On to the next slide, Brittany. You can see here some vaccine dashboard information for our 5 to 11-year-olds in particular. And we're up nearly at 55% for first dose coverage. There's a lot of ways to go, and we're doing everything that we can to make this vaccine accessible, but also to help support parents and caregivers for 5 to 11-year-olds as they're trying to navigate the discussion and the decision. For people who haven't seen it yet, there's a really nice resource that maybe you want to share if you know somebody who is trying to make their own decisions. It's called Parent Homework. You can see the website parenthomework.ca, and it's got information on reliable information on vaccine safety that I think is presented in a really nice and fun and accessible way for parents. And I think it will be helpful as they're navigating the best decision for their children. On to the next slide, Brittany, you can see we are continuing to present our dashboard with our case counts, but it's a bit of the tip of the iceberg because we know with changing qualification for PCR testing, many less people are being tested. So we only have 194 cases, active cases, which is a decrease, but it all overall is not painting the full picture. You can see that the dashboard is now reporting 5 more deaths than what we had 2 weeks ago. And I'll come back to that later in my remarks. If we move along to the next slide, you can see the picture at the hospital has also improved. They do not have any active outbreaks at the hospital right now. And the total number of inpatients they're reporting confirmed with COVID-19 is 8. So this is all a reassuring and encouraging picture with where we're at and where we're heading. Onto the next slide, you can see our number of outbreaks, which has decreased. 2 weeks ago when we met, we were reporting 14 active outbreaks, and our hardworking case and contact management team working with facilities has done a fantastic job to get those under control and to close outbreaks to the point that we only have 6, and that's still obviously very concerning, and we're doing everything we can to support facilities where those outbreaks are undergoing. On to the next slide, Brittany, you can see here our wastewater surveillance data. So we're going to go over this now. I'll draw your attention across the bottom to the axis. The date that the data we're showing starts is the 17th of January. And that's about when we started seeing the peak and decrease in our Omicron cases as reported in wastewater. And This is for Peterborough. So you can see that there has been a steady decline, a little bit of an uptick, a couple of times probably related to some transmission, certainly less than we thought, but some transmission when kids started back up in school and when the measures started relaxing at the end of January. But this overall is a very reassuring picture, and we're definitely headed in the right direction. What I want to say though is where we're at now is still a concern because it's much higher than where we were between previous waves. So if this continues, this means that there is still substantial Omicron transmission, even though we've decreased and we're past the peak and it's a better picture. It's not down to zero, which is near where we were when we were between previous waves in this pandemic. To look at a couple of our other jurisdictions where we sample, I'm somewhat concerned by the trend that we're seeing in the Lakefield wastewater surveillance sampling. And in the last week and a half, what we've seen is an uptick again in the wastewater surveillance data. This indicates perhaps there is more transmission happening, and we need to keep a very close eye on this. And I would encourage individuals living in that region to be particularly careful, but everywhere in our region, as things do open up and start to relax, continued care and sticking with some of the measures we can that we know don't cause a significant burden, things like wearing your mask, ensuring you're vaccinated, staying home when you're sick, those kinds of things will help to hopefully decrease this trend again. On to our next slide, you can see the picture in Millbrook, which again is a positive picture and on the decline. On to our next slide, Brittany. I'm just going to show this as an example. This is provincial data from the Ontario Science Table looking across the province at the different regions and at the wastewater surveillance. We fall into the Central East region in Peterborough Public Health region. And the picture there is very reassuring. But what you can see here is that there's a lot of variability by part of the province. And concerning, what the North is now experiencing is an uptick again that could be indicative that they may see another peak or a higher peak of Omicron transmission in the coming weeks. And what I think this shows is that there's variability in different parts of our province and that we all need to still continue to be careful, even though the overall picture is very hopeful. On to the next slide, Brittany. I want to just reiterate that the provincial public health measures are being de-escalated, and that is happening in an accelerated but cautious fashion. On today, which is the 17th, capacity limits will be increasing, and you can see our news release from today if you're interested in more details around that, or the provincial website. At this point, proof of vaccination is still required and masking is still required. Today, we are also rescinding the letter of instruction that we've issued for working from home. This is, I think, reflective of the better picture and where we're at now with Omicron. But I would encourage people that are no further burdened by working from home to continue to consider it where it's feasible. This kind of a measure can decrease interactions and will likely help to protect people who are more vulnerable and to help keep us all safer. So I think that that is important. And if you are bringing employees back into the workplace, some added precautions are certainly helpful. And we've talked about that in our news release today as well. So things like ensuring that mask use is consistent and appropriate, encouraging and or ensuring vaccination, as well as other measures, including improving ventilation in airspaces to decrease the risk of transmission. And we have all information about that on our website. On the 1st of March, the province will be increasing capacity limits further, and they've indicated the proof of vaccination will no longer be required. However, masking still will be required. And I think this is an important continued phase as the pandemic continues. We will also then be rescinding one of our other letters of instruction related to proof of vaccination in recreational facilities that will then align with the province and their guidance as the province cautiously de-escalates these measures. On to the next slide, Brittany here. One question and piece that I've gotten from a lot of individuals is this COVID-19 pandemic just kind of like the flu? Is this influenza? And I just wanted to share this data and show that it certainly isn't. In 2016 and 17 and 18, you can see in every year we had less than 5 deaths from influenza. And then beginning with the pandemic in 2020, we've had no deaths due to influenza. The reason is that the measures we've taken, including lockdowns, masking, has just decimated transmission of influenza. There have been no deaths in this region since the pandemic started due to the flu. However, COVID-19, we know, has taken a significant toll on our communities, with 25 deaths last year and 25 deaths already this year to the first half of February. So this pandemic, and that is with all of the measures, with the vaccine, and with everything that we've done. And like MPP Smith indicated in his remarks, the toll would have been dramatically higher had we not taken all of these protective measures. So I did just want to share this data because I think it's helpful and important to contextualize that the pandemic and the continued pandemic is still very much different than the flu. And we do have to continue to be careful, take every measure of precaution we can, and take it very seriously. On to the, I guess, sorry, that's pretty well the last slide there, I think, Brittany. But to finish with a few more remarks, we can see that the picture is optimistic and hopeful. We can see that the context is improving and the measures are correspondingly being relaxed. I think it's on all of us to continue to make individual level risk assessments, as our board chair, Mayor Andy Mitchell, indicated. We need to continue to take precautions, in particular if we are more vulnerable to severe COVID-19. That includes people who haven't yet been vaccinated, people who have medical conditions, people who are immunocompromised, or the elderly. But each and every one of us can also take measures such as continuing to adhere with the provincial recommendations, staying home when you're sick, continuing to rigorously wear a tightly fitted mask, and spending more time, if we're going to be visiting each other in the coming weeks, outside is always a little bit safer than inside. So certainly some enhanced precautions and measures will help to solidify the hopeful path that we're on to seeing the end of this Omicron wave. We are not through the entire pandemic yet, and I think it's very important to remember that. We've experienced significant new variants and waves on multiple occasions. And I think that keeping that in mind is really important as we move on to the next stage. The flu pandemic of 1918 lasted several years, and in fact we've continued to see influenza circulate in a high way because we couldn't actually contain it, and people began growing tired of public health measures. And each time a wave came, the number of cases increased, and with increasing number of cases, you actually evolutionarily select to create more mutations and more variants. And so the trajectory of influenza has been one that every year it's taken a significant number of lives. COVID-19 may be heading this way as well. We don't know what the fall will bring. There certainly is still a concern and risk that we could have another variant that is even more concerning than anything that we've seen before. But we're not in the same place we were when this pandemic started. We've learned so much. And I think for each of us individually and for our organizations, such as ourselves at Peterborough Public Health, now's the time to really learn and put in place this learning so that we can continue to protect ourselves into the future. On a personal level, there are going to be very different sentiments on what's happening right now. I think we're all hopeful and optimistic that we're moving our way through this. But just remember, kids under 5 have not had their chance to be vaccinated yet. We still only have about 50% of our residents with a 3rd dose. And so the protection against infection is not there yet. And so even though capacity limits are increasing, the proof of vaccination requirements are going to be ending, it still is on all of us to wear masks and to continue to take measures, including staying home when you're sick, to protect ourselves. The hospital context is improving, and that's encouraging as well. But just remember that staffing shortages and burnout and challenges that staff in healthcare are facing are not yet improving, and we need to look out for them and take every precaution we can to help with their work. The last message that I want to end on is one of hope. I think that we are in a very good position now, but let's not spoil it, and let's continue to do our part for some period still, and continue to take measures that we know don't cause harm and are helpful at preventing spread, so that we can continue to protect those who are more vulnerable around us. So with that, thank you, everyone. Thank you to our elected officials who joined today and shared very kind remarks for myself, but our whole team as well, who've been working tirelessly, through this pandemic and continue to serve the community, and look forward to questions, and thanks again.
Excellent. Thank you very much, Dr. Piggott. Okay, let's turn it over to our media guests. I think I see 4 reporters on the call today. And we also have joining us our enforcement partners from the Ontario Provincial Police and Peterborough Police Service. So let's start with Paul Rellinger from Kawartha now. If you've got some questions, we'll start off with Dr. Piggott, and then you can let me know if there's others you'd like to ask.
Thanks so much, Brittany. And yes, I had a few questions for Dr. Piggott. The vaccination numbers here, you indicated on the chart, have been very, very strong during the course of the pandemic. Is there a threat, or are you concerned that with things getting better, restrictions being lifted, that that rate of vaccination will stall?
Well, it already has stalled. We've seen only 4,000 doses in the last 2 weeks, which is a significant slowdown. I think that is natural. As the Omicron wave hit, people were extremely concerned. We've had a lot of availability, and we worked hard to vaccinate people as early as we could. So what we're seeing now is an expected slowdown. I don't think people realize just how important this 3rd dose is, and I really want to get that message out, because even now, with where we are and with increasing protection for future waves or variants, and the continued Omicron wave we're still experiencing now, the booster is helpful and important. But we have seen that slowdown, and I think what is important now and what our team's working on is finding ways to communicate and help people with their questions and hesitancies around vaccine, and make it as easy as possible. So we've been looking, how can we get closer to people? How can we get out to different sites and areas where it will make people most likely to get vaccinated? So those are some of the pieces that we're working on.
Thank you for that. And just another question, if I could, Dr. Piggott. I've heard from many people, and there's been stuff on social media about once the vaccine certificate requirement is lifted, people are saying, you know what, they kind of would go to a restaurant if there was a vaccine passport requirement because they just feel safer. What are your thoughts around that kind of line of thinking? Is that, I don't know if it's a agree or disagree thing, but what would you say to people who are feeling that way? Because it's a fair number. They're out there.
Yeah, thanks for that question, Paul. I think that I can understand, and in this next phase of the pandemic, some people will feel more anxious and concerned than others, either because of their own perspectives or beliefs, or because of their own circumstances. I still am trying to take every precaution that I can, because I've got 2 little girls at home that aren't vaccinated yet. So I can appreciate and understand that. From the standpoint of the proof of vaccination record, our Board of Health wrote to the province last week requesting consideration that a 3rd dose be incorporated into that, because as it stands now with 2 doses, the proof of vaccination is helpful for individual precautions, but it's not helpful to be reassured that those around you won't spread Omicron. A 3rd dose is really needed to know that the risk of spreading the virus is lower. And so as it stands now with a 2-dose dose requirement, I don't think that that vaccine passport is as helpful as it's been in previous parts of the pandemic. And I certainly can understand where the province is coming from with the movement on that front. And I know too that the province has indicated that businesses that wish to continue to use it can certainly do so. So I anticipate, and in conversations with individuals through our team and relationships we have here in the community, I anticipate that many will continue to utilize that tool and to take additional precautions, as we all will in our individual lives.
Thank you for that. And just one more thing, Dr. Piggott. I guess it's really a clarification. Just it says there'll be no update on the tracker today. What's the reason for that? Do you know?
Well, I think that's just staffing related today in the context of the work on that. We're not seeing significant changes now with the tracker data, so we are reevaluating how and when we'll be updating it. But today's just an anomaly because of staffing, and it's a very technical piece to do. So I believe that's where that's coming from.
Thank you for that. Inquiry minds need to know, right? So
yeah, no, of course. And what I will say, because we've done this before, is if there's a dramatic change, we'll be communicating that via another way. We've done this before, where something happened on a holiday or a weekend. We've communicated via other channels. So rest assured that the public will know if they do need to know anything.
For sure. Thank you. And I had a question, if I could, as well, for the city police representative who's on the call today.
Okay, thank you. I think Inspector Lyons is with us today. So if your camera's up, I'll put you on screen there.
Hi.
Hi, Inspector Lyons. We've heard a lot of talk about this, I guess, quote unquote, convoy slow roll that's going to happen or may happen this coming weekend. I'm just wondering, if you have indications that's still going to go ahead, you're watching that, and what sort of general enforcement would there be around that?
Hey, Paul, and thank you for the question. So essentially, much like any of the past situations that we have been aware of, we certainly do monitor those. We definitely are prepared in any regard for what may happen. There's a lot of planning goes into it, a lot of background, but we're certainly in that position that we are aware of it, and we'll take whatever actions are necessary to ensure the safety of those involved. And that's always our primary goal, is to provide that safety and to make sure that that people, if they're going to come out and take part in, that they are safe doing so.
And sorry, just one more thing further to that. So basically, I take it your message would be, as long as it's peaceful and orderly, police have no problem.
I mean, obviously, if we had the ability to to thwart it from happening, we would certainly try to do that. But again, we're also understanding that people do have that the right to to come out and take part in peaceful protest. And that's really what we're always the fine line between, is just to make sure that we're providing that ability, but it isn't causing any undue harm to anyone involved in the in that process, or that may be in the proximity of. So it's just a matter of making sure that that's happening in a safe manner.
Right. Thanks so much, Inspector Lyons. I appreciate that. And just one more question for MP Ferrari, if I could, please.
Okay, sure thing. I'll put you up on screen there, MP Ferrari.
Hi, MP Ferrari. How are you today? You can hear me, I think.
Oh, I think you're muted.
So sorry. Hi, Paul. Thank you. I'm good. How are you?
No problem. I'm doing well. Thank you. I wanted to get your take. You're in a unique position really on this call, because you've had a front row seat to what's been going on in Ottawa in the last couple of weeks out on the street, and we have a potential, not for the same type of situation, but we have this protest that's planned, and who knows how big it'll be, coming up this weekend in Peterborough. First of all, your thoughts on that? I know, and I think it's been no secret that, you know, you haven't really been speaking against the protests, and you haven't really necessarily been speaking for the protest up in Ottawa. But you know, do you kind of support what they're doing as long as it's a peaceful thing, or like, I just want to get a sense of your take on it.
Thanks, Paul. You know, I think it's over. I think I've been pretty clear about the expiration date. I think, you know, you have a wide range of people. Obviously, those on the extreme ends of things, there's zero support. Things got extremely heated yesterday in the House of Commons. For anybody who watched, it got a little personal. And to go back to what the warden said and what Andy said, it is about kindness. And what I really feel like right now is if we can be united locally, we can be united nationally. So if I can sit here and support my MPP and my warden and my public officer of health, and we can have conversations and support each other, I think that's going to be really valuable on a country front. The messages I've gotten, it's emotional. Like it's heartbreaking to see the divide and the trauma that people have experienced here. And I think, excuse me, I think what would be ideal, and I guess what I would say is, I don't want to get political. I really don't, because I think it doesn't help on a local level. But this all could have been avoided. And I think if we can do that in Peterborough, you know, listening to Officer Lyon, I think it can be avoided. And crisis management is really listening to people. It's really listening, not the extremists, the people who showed up at Dr. Piggott's house. That's not what I'm talking about. So I just hope that it can resolve peacefully and we can all work together. And I think it's unfortunate that we've gotten to this point.
Thank you for that. And just a clarification, when you say this could all be avoided, like, can you just expand on that? How do you mean?
I don't think we needed to get here. I think that it was lack of leadership that got us to this point. You know, we've had protests for years, decades in this country, and crisis management is going out, listening to people, diffusing the situation and moving on. And so I do put a lot of blame on our Prime Minister because, you know, as he said, and if you saw in the House of Commons, he said, you know, you don't invoke the Emergency Measures Act lightly. You have to do step 1, step 2, step 3. And I asked him what were those first 3 steps he did, and he didn't. And crisis management is going out and diffusing the situation. Talking to the cops on the ground, they've said you can't use force. We've worked in Caledonia. People want to be heard. Go home, right? Go home. We were able to peacefully get all of the blockades from the border crossings resolved, and I think it just didn't need to get to this point.
Yeah, and I guess you would hear a different opinion on what you just said from someone who lives in that neighborhood and has to put up with it every day.
Oh, I have to put up with it. I live here right now. The horns are ridiculous. Like it's disruptive. Mm-hmm. So it's absolutely disruptive, and it's time to go home.
Thanks so much, MP Ferrari. I appreciate your candor on that. I really do. Thank you.
Thank you.
Thank you both so much. Okay, I'm going to now invite Matt Latour. If you've got some questions, please, for Dr. Piggott or others, do go right ahead.
Yeah, my question today is for Dr. Piggott. It's actually about the Twitter thread you did yesterday when you spoke about H1N1, Ebola, Zika virus, things along that matter. What do you think, you know, aside from the longevity, what do you think about COVID-19 is so different from these other viruses that we've, you know, seemingly gone through the brunt of rather quickly?
Well, I think that this has not just been a public health crisis. This has been all of society crisis, right? It's ground economies to a halt. It's kept kids home from school. It's disrupted our everyday life for 2 years. It's also taken a tremendous death toll, and now nationally we've lost more than 35,000 lives from this virus in the past 2 years, and we would have lost perhaps even a tenfold more lives had we not responded as we have. I think that what we know is that pandemics come and pandemics go. And as this Omicron wave recedes, it's really critical for us to all learn from this so that we're more prepared for the next wave of perhaps COVID-19 or a whole new pandemic. And we need to learn from everything that we've done, the progress that science has made, the work on vaccines, the use of a mask for an airborne respiratory virus outbreak. These measures have saved lives, and I hope that we continue to learn from that and to really entrench that so that on a go forward, we're more ready.
I know in a couple of weeks we're going to see the proof of vaccination certificates kind of phased out by the province at places like restaurants. But the province has kind of mentioned that if restaurants want to keep that in place, they can. If a restaurant or someplace needs support with that, do they contact public health, or is that all through the province?
Well, we're continuing to support. Our work here is not done. And as much as some of the measures and the enforcement work that we have to do is declining, we've been doing most of what we've been doing throughout the whole pandemic is keeping businesses open, helping restaurants. If you recall, before the provincial lockdown for the Omicron wave, I put out a letter of instruction with a bunch of very protective measures that really didn't impact businesses too much, but were intended to help to make places safer. And that's been our approach throughout: is helping people, helping businesses, helping them to be safer. So we'll continue to support. I think we have a lot more work to do, and we'll continue to support local businesses any ways that we can.
That's it for me. Thank you as always.
Thanks,
Great,
Matt.
thank you so much. Thanks, Matt. Okay, Jessica Nisnik is joining us here from Global News. Go ahead, Jessica, if you've got some questions for Dr. Piggott.
Thank you, Brittany. I do. Hi, Dr. Piggott. Thanks for the update. You mentioned that last week you wrote to the province to suggest that a third dose be added to the Vax passport. Was it just you? Sometimes Dr. Salvatierra would get together with other medical officers of health and maybe do it together. Was it, again, just you, or did anyone else jump on board with you?
This was the Board of Health. So our chair wrote the letter to the ministry um, on recommendation from our staff and a review of the evidence. Ottawa Public Health has also, their Board of Health has also written regarding third doses in a similar way. And sometimes we do see others share similar sentiment afterwards. I think this was last week, and with the announcements of this week that the vaccine passport will be finishing up on March 1st. I don't know how relevant others will find that obviously now, but I think our Board of Health felt it was important to comment on the evidence around that.
Thank you. And I covered the HKPR meeting yesterday, and I'm sure you saw that they're closing their mass immunization clinics, the two main ones. Is there any thought in Peterborough when they might close? Where are we at with that?
We're constantly evaluating access and uptake and need. Other health units may have a different context because they may be operating more sites. We've largely centralized and focused our efforts at running a very efficient, accessible clinic at the Healthy Planet Arena in combination with other outreach that we've been doing. So at this stage, we haven't made any plans to stop that. We're still getting significant uptake and walk-ins amongst all of our age brackets, and we still feel that is important, but obviously we'll be responding to community need and demand on a go forward basis.
Thank you. One last question for you. Yesterday, Dr. Bocking was talking about the rat tests and the swabbing, and that there's been recently announced, information saying that, using the cheek swab and then doing the nose. Can we do that with any kit, or does it have to be specify a certain kit?
Thanks, Jessica. We've put information out on our social media, and our team had this nice catchy phrase of get a little bit cheeky with your testing. It applies to all of the kits out there, and it doesn't matter which brand it is. But the evidence that has been reviewed shows that it will be a little bit more likely to pick up a positive case, and so it is helpful to add in the cheek, throat, and nose swabs when you are using any rapid antigen test kit that is out there and available. And again, we have through social media and on our website some of that information and direction on there.
Perfect. That's great, Dr. Piggott. No more questions for you. I just have one for our MP.
Okay, thank you. I'll put you up on screen, MP Ferrari.
Hi, Michelle.
How are you?
I'm okay, thanks. How are you doing?
Good.
So, you know, you've mentioned that our leadership has failed us. We all, I think, know maybe something should have been done before it got to this point. But what do you suggest? If you say leadership has failed, you must have an idea of how this can be done properly. So what do you suggest?
Yeah, I think it's a really simple answer, to be honest with you. I think it's about listening to people. You know, there was an Idle No More protest here. I don't know what year. It was under Stephen Harper's prime minister time, and they blockaded the prime minister's office, and he organized a roundtable with everyone, sat down with them for a full day. They all peacefully left. So I think it's just a matter of what many crisis management officials have been recommending from day one. It's listening, and that's again back to my question in the House of Commons. Where was step 1, step 2, step 3? We didn't even see our leader for a week. He was gone.
I agree with you there. We didn't see him, but do you think it's a good idea for someone to negotiate with people who have threatened violence against him?
I think it needs to be done. That's a really hard question, right? Because I think the extremists and the background of what these extreme views are not what the convoy or the protest became. So I do think there is a really hard question that's been brought up of who do you meet with? Who are those people? Because it started as one thing and became something so much bigger. And so I think if you had have came out and did a social media post, maybe you couldn't have sat at the table. But maybe if you had have said, I see you, I hear you, your message was delivered, you know, we will discuss, please go home. But he didn't do that. He called everybody names, these people. It just wasn't handled like a leader. And he leaves. When you're sitting in question period, he gets up and leaves. Leaders don't leave, they lead.
Thanks, Michelle. That's it for me.
Great, thank you both. Okay, so we'll move on to Bill Hodgins, and then after Bill, if there's any follow-up questions from Reg Watson, we'll turn it over to you. So Bill, go ahead if you've got some questions for Dr. Piggott.
Yes, for Dr. Piggott, please. I've noticed in the last day or two, a lot of people that are, I guess, in support of lifting mandates are asking, what about masks? And, you know, you turn on the Super Bowl, there's 70,000 people without masks on the hockey game and stuff, and it's hard to convince people why masks are still necessary. Do you think that's coming soon too, a lifting of the mask mandate?
Hi, Bill. Thanks. So obviously that's a provincial decision, and I'm not aware if it's coming soon. What I will say is that after the vaccine, masks are probably our second most effective tool that we've put in the toolbox through this pandemic. They play a tremendous role, especially more tightly fitted masks such as the KN95 and 95 type masks. They play a tremendous role in preventing spread and protecting ourselves. We know that especially where ventilation is not as strong, when you're closer to other individuals, they are important because some people that can infect others with COVID-19 do not have symptoms. There is asymptomatic spread. It's an important component of this virus, and the masks have helped and will continue to help. So I continue to wear mine. I continue to advocate that we continue to use masking as much as we can. It's an intervention that comes with minimal harm other than a bit of inconvenience and nuisance. It's something that in many other countries and cultures is broadly utilized and was before the pandemic. No, I don't think that we'll be wearing masks constantly every day into the future. I think there may be times that we'll want to start wearing them again if it's looking like the COVID picture is getting worse. But right now, even though it's more hopeful, there's still lots of Omicron transmission happening, and the masks are a way that we can prevent the need for future, potential lockdowns or burdens on the healthcare system. So I think that they continue to be quite useful, and I continue to recommend their use.
Excellent. Thanks. That's all for me.
There we go. Thank you. Thanks so much, Bill. And I've heard from Reg that his mic is not cooperating today, so he'll send us any questions through email after the fact. Okay, I think that brings us to an end then. So thank you all for joining us. Thank you especially to MP Ferrari and MPP Smith and County Warden Jones for being a part of today's media briefing, and of course to our reporters for helping us get the accurate information out about the community. Thank you so much, Dr. Piggott, for your cogent update as always, and we will see you back here in 2 weeks on March 3rd. Okay, have a great evening. Stay safe out there. Bye-bye.
Thanks,
Thank you.
everybody.
Thanks, everyone.
Thank you so much, everyone.